and get there. Ms. Saint-Cyr, will you be the one starting it off, or would you want me to start it off?
You're mute.
Oh, you're right. You can start off first. Thank you for asking.
Okay, awesome. All right, are we live now?
We are currently recording.
Awesome. And everybody's pulled up, correct? Everybody's on? All right. Hello, everybody. My name is Rodney Duckett. It's an honor and privilege to have you guys here with us today for this wonderful, beautiful topic that we have. I'm honored and blessed to be a part of an esteemed panelist that's going to take us down a venture and a journey to better ourselves in our academia practice, and also those that might be interested in academia. You might be in that crossroad right now. You want to do more to give back to the nursing profession that has done so great for you. But at this time, before we get started, I just asked a couple of things. And first of all, in the world that we're living in and all the stress and everything that's going on and the loss of lives, at this time, if you guys can just join me in a moment of silence. This moment of silence is for those nurses that are burnt out, stressed out, those academia professors that are burnt out, stressed out, those actual graduate students that's in school that's trying to get those hours together, those nurses that's on the floor that are sick and struggling every day to go to work, and also those nurses that are forced to retire based off their health, and also those nurses that have passed away based off of COVID and other comorbidities. Let's, at this time, if you please could join me for a moment of silence. Thank you guys for your moment of silence. And thank you guys that's here with us today, navigating your first year of academia and beyond. Like, again, I have this esteemed panel that's with us here that's going to give you guys an abundance of information so that way you guys can apply to your nursing career and profession, and also take this information back to others that could not be a part here today. I will ask everybody to keep Dr. McCamey in their prayers. She's not here with us today, but as we know, sometime when the gooses are traveling south, sometimes they change directions, and leadership have a tendency to form that V vortex to move us forward. So she's still with us and she's hanging on. She's getting our tailwinds right now. At this time, I'd like to leave you guys with this. And this is what I wanted you guys to take away from all of this today. One of my things before I walked into nursing is I had a degree in archaeology. And archaeology took me all around the world, and I traveled and I've seen a lot. Talked to very interesting people along the way. And one of the questions that's always stood out to me was this question right here. I met an Ethiopian monk in a place called Lightbulb, Ethiopia. And this monk always had interesting things to say. And one of the things that he asked me was, young man, what is the largest room in the world? It is me, being the smart guy that I am. I said, outer space. I said, my soul. I said, the depths of the sea and the ocean. And he just laughed and he laughed and he laughed. The largest room in the world that I want you guys to take from this is the room for improvement. And we're all here to improve at this day and time. So with that being said, I'm going to talk to you a little bit about DNPs of color and what does it mean. Our mission statement is to serve DNPs through a networking mentorship program and advocating to increase the diversity in doctoral studies in clinical practice and leadership. Our vision is to inspire, empower, transform a landscape of nursing by increasing the diversity in doctoral nursing practice. We are blessed and fortunate today to have a wonderful panel that has a very wide range and diverse range of knowledge, intellect, and how to navigate this very complex and confusing world of nursing, especially when it gets into the realm of nursing academia. But before that, I can't do this alone. I have a wonderful, beautiful co-host that's going to help me navigate through this system. At this time, I would like to introduce my co-host, Miss Mary Rose Saint-Cyr.
Thank you so much, Dr. Duckett. Yes, my name is Mary Rose Saint-Cyr. I'm currently a second career nursing student and I live in Boston, Massachusetts. So I'm going to quickly go over our guidelines for today's event. Before we begin our panel discussion, please drop your LinkedIn and social media handles in the chat. This will be a great opportunity for us to build networks amongst ourselves. At the bottom of the screen, there is a Q&A feature. So please use that to pose questions to our panelists. I will work with Dr. Duckett to ensure that your questions are relayed to our panelists. We will reserve the last 15 minutes of our time together to engage in dialogue with the audience. So please remain on mute throughout that time. But lastly, we respect and honor your confidentiality in this space. So what's said here stays here and what's learned here leaves here. So I'm going to pass it back over to Dr. Duckett.
Again, this topic is very important. Nursing faculty, navigating your first year of academia and beyond. Our panelist discussion on experience and tips for anyone interested in or currently working in academia. With that being said, we have a wonderful panelist that's here with us today. I'd like to start off by first going through and introducing my panelists by name, and then going back through and have my panelists pretty much give us a quick synopsis of who they are, why they're here, and the importance they're going to give us today. First panelist that we have is Dr. Imelda Reyes. Second panelist we have is Dr. Julian Gallegos. Third panelist we have is Dr. Dwayne Alleyne. And our fourth panelist we have is Dr. Selena Gilles. I'd like to turn it over right now to Dr. Imelda Reyes.
Good evening, and thank you so much for attending today. My name is Imelda Reyes, and I am currently faculty at Emory University. I've been with Emory, it's here in Atlanta, Georgia, for about 9 years. I actually celebrated my 9th anniversary 2 days ago. And I also have a clinical practice with Children's Healthcare of Atlanta. I'm an FNP, PNP, and I did my DNP at Vanderbilt. And what else was I supposed to cover?
I think that's it.
Okay, great, thank you.
The next panelist is Dr. Julian.
Good evening, everyone. I'm Julian Gallegos. I've been in academia for 6 years, full-time. I'm currently at Purdue University. This is my second year here. Previous to that, I was at Todo University, California. I'm the DNP director for Purdue University. Unlike a lot of our panelists here, I do not have a DNP. I actually have a PhD, but I have a special place in my heart for the DNPs.
Next panelist is Dr. Alleyne.
Hello, everyone. It's a pleasure to be here. I'm glad to see this came into fruition. Just for background, this panel discussion came about from someone that posed a question on DNPs of color, and I can't remember who the person was, but they said we should do a panel discussion. So I reached out to Dr. McCamey, and here we are, and we had such a great response. So I'm glad that this came into fruition. I think this is a very important topic. But I'm currently a clinical assistant professor at the University of South Carolina. Today officially marks my 1-year anniversary as full-time academia. So this is a special moment. It's a coincidence that we all picked this date, and I didn't realize until after it was scheduled. I said, well, you know what, this is my anniversary. So how ironic. I also work as an acute care nurse practitioner. I've been an acute care nurse practitioner for 12 years, working primarily as a hospitalist. I just got my DNP in 2020. I'm involved in a lot of things. I'm the executive director of a local nurse practitioner group in Columbia, South Carolina, and recently got added to the board of advisories for DNPs of color. Also a member at large of the state organization. So I just looking forward to working with everyone. I'm glad to be around such intelligent, highly academic people. You guys already made me smarter just by being in your presence, so I appreciate it.
The next panelist we have is Dr. Gilles.
Hi, everyone. Thank you so much for joining us. I'm Selena Gomez. I have been in nursing for 16 years. I am currently a clinical associate professor and associate dean of the undergraduate program at NYU. I have been in nursing education for 11 years. I'm actually going into my 8th academic year full time. I completed my DNP at Monmouth University in New Jersey back in 2014, and I'm very glad to be here with you today.
Thank you, panelists, for that wonderful introduction. And now, without further ado, we're going to get into some of these topics and questions that's been designed here. First question is, what courses do you currently teach? And I'm going to open that up to all the panelists that we have.
I can start. So some of the courses that I teach currently include my specialty courses in pediatrics. I also teach pharmacology for all APRN students. And I think, yeah, health assessment. We have a pediatric focused health assessment class in wellness that I teach as well. And so it definitely keeps me busy. And then I also teach in the DNP project courses.
For myself, the one thing I forgot to mention in the introduction is that I'm actually a family nurse practitioner as well. So I teach the 3 Ps, advanced patho, advanced pharm, advanced health assessment to our nurse practitioner track students. I also teach the roles transition for nurse practitioners at the DNP level. And I actually teach one of the first few courses for the DNP project as well.
I recently transitioned into administration back in January, so my teaching load is a little bit lighter now. But in terms of courses that I have taught in the past, I've taught pathophysiology, also a major part of the medical surgical nursing courses. I'm heavily involved in NCLEX prep in our undergraduate program. I'm also the co-director of the Hartford Institute Geriatric Undergraduate Scholars Program, so I do teach 2 geriatric courses, and I also serve as faculty mentors for DNP students as they're completing their degree.
So just like I mentioned before, I'm just a year into full-time academia. So I primarily teach pharmacology, advanced pharmacology, like one of the 3 Ps. I've been actually teaching that before I became full-time, and that was my leg into full-time academia. Someone had me slowly take over that course. So I've been teaching it for about 3 years, but full-time for a year. And also created a course. I had the pleasure of creating a course called Nursing 772, which is an introductory course for adult and geriatric care for diagnoses and treatment, and also taught for the first time as a full-time faculty, Nursing 786, which is the advanced care of adult and geriatric patients. I'm also DNP chair for the acute care side since I'm one of the few acute care nurse practitioners in full-time, I'm a DNP chair for those in the acute care track.
Next question that we have, and this is kind of open because I want everybody to go through and also elaborate their positions and their roles so people can better understand the difference. So what is your current status as a professor? Are you an assistant, associate, tenured, or non-tenured? And if you can please explain what that means to the audience.
I can start. I'm a clinical associate professor at Purdue University. It's a non-tenured position here at Purdue. We do have tenured positions, which the difference between the 2 here at Purdue specifically is that tenured positions are given to PhD prepared nurses who are primarily researchers. Unfortunately, our system does not allow our DNP faculty to actually transition into the tenure track unless they go on to obtain a PhD. For those of you in the audience who don't know what the difference is between non-tenure and tenure, tenure essentially is after a certain amount of years in a position, these faculty afforded the opportunity through their service, research, and other criteria that the universities look at, allow them to progress typically from an assistant professor position to an associate professor position. And that tenure basically guarantees them a job for life if they're able to achieve it. And willing to stay at that university for the remainder of their career. I'll let the others elaborate and if there's anything else different or anything else.
I actually moved through the ranks rather quickly in my 11 years in academia. I started out as a clinical instructor. When I finished my master's in 2010, I was starting to work as a nurse practitioner, and I started doing adjunct in the clinical setting. So I did that for about 4 years until I finished my DNP in 2014. And at that time, I became full-time at NYU as a clinical assistant professor. And then just last November, I was promoted to clinical associate professor. And at my institution, you have to actually have a PhD in order to be tenured. In January, I became the director of the undergraduate nursing program. And as of June, I am now the associate dean of the undergraduate program. So my role is pretty much administration, although I do teach here and there.
So my position here at Emory, I'm an associate clinical professor, and similar to the other two schools, the tenure positions are reserved for PhD. I transitioned in 2012 when I finished my DNP into my role as a clinical assistant professor. And it's been very interesting going through the process to be promoted, putting together dossiers and getting letters and everything. But yeah, it's been a really great transition, and I've really enjoyed it, and also keeping my foot in the clinical realm.
I'm a clinical assistant professor, and just like many of my panelists have mentioned, there's usually the tenure position is reserved for the PhD faculty. It looks like based on the track, based on the faculty track, it'll probably take me at least 2 to 3 years before I can move on to the associate. I actually was able to look at the things I have to achieve. So I have a little more to do in order to get to that level. And they are the USC or UFSC or the College University of South Carolina is looking at having a DNP be a tenure track. We're looking at that because a lot of us are clinical, so they are reviewing that because there's a lot of talk about how that can be valuable since a lot of us work clinically, especially in the hospital setting. So that's something that's in the works. So I'm interested to see how that comes about.
This leads me to another alibi question that goes along with that. It's that battle of tenureship for DNPs. There's a big surge that's happening right there with the baby boomers retiring very, very early because that era is walking out of nurses, which leaves approximately somewhere about 1.7 million nurses that are going to walk away from the nursing profession. So with the tenureship that's there, how do you guys feel about DNPs also receiving the tenureship based off the value that they bring into the profession?
I think that's a great question. And one of the things that I'll say is that I have colleagues that are DNP prepared that are in positions and do have the availability to pursue the tenure track. And one thing that I noticed between my colleagues that are on the tenure track versus me on the clinical track is that my colleagues that are on that DNP tenure track are really focused in research and have to meet certain benchmarks. And for me personally, I love the research that I do and the evidence-based, translational piece that I do in teaching. And my scholarship is really focused on reproductive health for, adolescents, and looking at teaching strategies and innovative things that I do on the teaching side, which don't necessarily lend themselves well to the research side of things. So even if I were at an institution that allowed me to apply for the tenure track, I think I would still opt for the clinical track just because I think it aligns better with my teaching, my service, and my practice.
I'd have to agree with Dr. Reyes. There are differences in terms of that terminal degree. But for me, when I was looking at selecting my institution, the ability to obtain tenureship wasn't necessarily a priority for me. I am a nurse practitioner, and my clinical practice for me takes precedence over research, although I'm still able to participate in activities such as quality improvement. I do have colleagues who have their DNP and have gone back for their PhD because their focus is much more research and it makes more sense for them. But for me, it wasn't a deal breaker that I could not obtain tenureship at my facility.
I can say the same because I actually looked at what it takes to get, maintain tenure. There's a lot of research, and I told this story before. When I first started as a nurse practitioner, I detested research. So it kind of grew on me, especially when I got into the doctorate programs and I see the value in research, but I don't have that strong interest to be delved into as much as you have to get tenure. So it may grow on me. I may end up doing it, but right now my primary interest is in the clinical track.
And for me, you know, if I have the opportunity to get into a tenure track, I will. I'm fortunate enough to have a PhD. However, with a PhD, I do feel that the DNP should have the opportunity to acquire tenure just like a PhD. The science that we work with it's different, but it's parallel to each other. So, you know, I think we work symbiotically between DNP and PhD, and that's how it should be. I just think that the hierarchy has been established already. It's dismantling that hierarchy and rebuilding it, I think, is what we need to do. As those of us who get into administration, especially DNPs and PhDs of color, we need to start looking at those things to make things a little bit more equitable across the board. So I'm all for our clinical faculty obtaining tenure.
This question is for Dr. Alleyne, and also you guys can chime in as well. Discuss the actual progression into the academia world. You initially said that there was a lot of work you still have to do to meet that associate professor. So can you just kind of explain that track, and then you guys pretty much chime in as well too.
Okay, so it may be different for each person, but we get, I forgot the name of it, we get a layer of of our workload. I call it workload assignments. And some of you probably get the same thing. I see you shaking your heads. They assign percentages of what you need to do. So you have your academic track where you teach courses, they assign a certain percentage. If you work clinical hours, like for instance, I get 20% for my clinical day, which I work 1 day a week for 12 hours. And then I get 5% towards scholarship. And then I get a certain percent towards community service or leadership. So based, long as you meet those qualifications, you satisfy what's necessary for your evaluation, you're able to get progress up the track. So you have to meet these. For my school, I say I have to meet these every time for the next 2 or 3 years. Then I get promoted. And also comes into play is your student evaluations. You have to, they use, I don't even understand the terms, but they use these metrics, they call it TUQ or MEQ, and you have to record it on your evaluation because it tells you like what's the percentage of students that like you. And if you have to maintain a certain level, like for us, we have to make sure we stay above 2.5, whatever that means. So if you obtain above 2.5, that goes into part of your evaluation. As long as you maintain those standards, you can get promoted. And also if you do certain things like, so it gets harder, of course. And, you know, if I get to associate professor, it gets harder to get to professor. I have to do a lot more. Like for instance, if I became an FAN or FAMP, that'll help me, give me the extra achievements or accreditation to move on to professor level. So the more you do, the more you can advance.
Each institution has its own criteria. And like I said, I was in the instructor role for 4 years before I actually became full-time, and I needed to have my doctoral degree in order to become a clinical assistant professor. So when I started full-time in 2014 as a clinical assistant professor, of course, your institution does give you that criteria because you have to develop some sort of career plan, career trajectory, so that you can meet those goals if you want to be a clinical associate and a clinical associate and a full professor. So for us, and I'm sure this is true for the panelists as well, they're really looking at three things: teaching, leadership, and scholarship. So what Dr. Alleyne mentioned in terms of teaching, looking at the courses that you taught, the courses that you've developed, the courses that you've coordinated, in addition to your student evaluations. And then that leadership piece can be several things. So it could be leadership at the college level, leadership at the university level. So I'm talking about things like being on committees. So for example, I've been on the curriculum committee or the search committee, and I've also been on university committees. And they also look at things that you do outside the institution in terms of leadership and service. So I'm a part of the National Black Nurses Association. I'm a lifetime member. I'm a founding member of the Greater New York City Black Nurses Association. So they want to see that you're doing other things outside your institution. And the scholarship is also the big piece. And what I find in being a clinical associate professor is that most of your time you spend that teaching, but it's not the biggest part of what you need to do in order to move up the ranks. So that scholarship piece is very big. So it's not just about publications, but what other types of things have you done? Have you presented at conferences? Have you been interviewed by a newspaper or on television? Have you developed webinars? Have you done like things like this and been a panelist? So it's really fulfilling that criteria as it relates to teaching, that leadership and service portion, and also the scholarship. So you have to have a good mix of all three to really move up in the ranks. At my institution, there isn't a requirement for the number of articles or the number of conferences that you have to present at, but at some institutions, it might be.
And what I like to do right now is we have in our chat room a few questions, and I like to direct these questions to Dr. Reyes and also Dr. Gallegos. So I'm going to have Miss Saint-Cyr, if you want to come in and chime in on a couple of questions we have in our chat box.
All right, so we have a question from Ms. Saunders. It's, what advice would you give to someone interested in getting their foot in the door of academia?
Mm-hmm. And I think that's a great question. One way to get involved is if you can find an adjunct position at some of your universities. That's a really great way to kind of test the waters. You're not making that full commitment. You know, schools do it differently. Here at our school, we have adjunct. We also have clinical instructor positions, which like for a site visitor, for instance, you can get involved in a class, be, you know, check over logs, do site visits, you know, be involved in simulation. And then their level of interactive or how interactive they get with the class is kind of dependent on them. So they have like set standards, but we've had some site visitors that might do a guest lecture, for instance. So that's a great way to kind of, again, get things kind of started. And then, you know, you can also do what I did, which was just jump in 2 feet first. And I finished my DNP and I did the nurse faculty loan. So my institution had that available, which was wonderful. It paid for all my entire DNP. The only response, or the only thing I had to do is teach for 4 years to get the whole thing forgiven. And so I was on a clock because at the time I graduated, I had 6 months to find a position. And I didn't want to pay back the loan. So I started looking for positions and found one that worked well for me. So that's kind of how I got started. But the clinical instructor adjunct positions are wonderful ways to get started.
I have to agree with Dr. Reyes. Instructor, adjunct, lecturer positions, sometimes different institutions have different names for them. Another opportunity would be, you know, if there's no opportunities at the four-year institutions or graduate institutions, would be looking at community college and starting there and building up your CV or curriculum vitae, so that way you can use that when you do apply eventually to a four-year program position or university level position, so that way leaders can see that you've been interested in teaching, you've done some teaching, and are ready to move on to the university level type teaching. I just happened to come into academia by chance. I was working in a clinical position at a small community hospital, and a nurse who knew another nurse who was developing a whole school of nursing for Purdue University, California, said, "Oh, you got to get this guy to teach your 3Ps for you." So I started as adjunct, and then I did that for a semester, and fortunately they opened up another full-time faculty position, and I was able to get in that way into academia full-time.
I would say you have to crawl before you walk, and one of the ways to get in, because I've heard a lot of people saying they tried and tried, they could not get in. One of the ways to get in is to network, because sometimes people will tell you about jobs that's not advertised. I'll give an example of how I got in, because I mentioned I was executive director of a local nurse practitioner group. One of my colleagues told me, hey, and I was even, at that time, I was even thinking about academia. I had no desire or anything at this time, but one of my friends said, hey, you want to make easy money? They're looking for these clinical instructor positions. Easy. All you have to do is take on students and grade their papers and have them come on your clinical site. So I did that, and that was very easy. They just came on. I just hosted a student. Like, you just have to host them, and they stay for this one day. I had 14 students, I remember, and I had to separate them through over a period of 3 months and just watch them and then have them see a patient and critique them. And I thought that sparked my interest for teaching. And students say, yeah, I got great feedback. And they said, yes, you should be a teacher. And then later on, I took a year off, and then I got back into it. And at that time, there was a different program director. And I told her when I was applying again to be a clinical faculty instructor, or they use the term TFAC, temporary faculty, I thought I was thinking of doing my DNP. So she told me, send me an email saying, hey, when you get your DNP, you should become full-time faculty. So she's the one that eased me into my current role, because what I did is just maintain my role as a TFAC, where I just graded papers, and then I just checked off students doing immersions and stuff like that. And then she said, hey, I got this pharmacology class. Do you want to teach it? I said, sure. So she eased me in, and she said she let me teach just half of the course. And then the next semester, she said, just take over the course. So while I was in my final semesters of DNP school, working full-time, I actually taught a whole pharmacology course. So I did a lot. And then they wooed me in to take over full-time and just be a full-time faculty. So yeah, I kind of worked my way in, but I would have to emphasize network. The jobs don't, if you can search all you want, you can look at Indeed and all these places, but this job I never heard of until it was by word of mouth. So
I agree that networking piece is really important, and being an adjunct is a really good way to get your feet wet. I always tell people that I got into academia by accident. I had actually just finished my master's degree, and I was looking for a job as a nurse practitioner, and I was still working in the ICU as a nurse. And just randomly one day walking in the hall, I ran into a colleague from when I used to work on a med-surg unit, and she said, hey, I noticed that you finished your master's degree. Would you be interested in teaching? I think that this would be something great for you. And she was working at NYU as an instructor. So she was the one who got me into the program. And I started working as an adjunct and taking students to the same hospital that I actually worked at. And I really enjoyed it. And then I found a job as an NP, and I started precepting NP students. And I felt like, you know what, this is something that I like. This is something that I really enjoy. And I think that I really can do this. So if I want to take this seriously, I should go back to get my DNP. So 2 years after finishing my master's, I went to school to do my DNP, still while working as an NP, and work-life balance was a little bit tough. I'm sure my fellow panelists could could agree with me. But I completed my DNP, and when I was in the last semester of my DNP program, I actually left my clinical practice and I started working full-time in an associate's degree program. Realized quickly that was not for me. I stayed there for 2 semesters. And once I was about to graduate with my DNP, I emailed the dean of NYU, where I had served as a clinical instructor, and I let her know that I was finishing up. And a week after my graduation, I actually had my interview to be a full-time clinical assistant professor at NYU.
And what we'll do now is we'll transition into the next questions. And as people are sending questions through your chat, we're going to hold these questions, and these questions will be answered. But for brevity's sakes, we're going to move on to the next set of questions, but we will still have a follow-up with a series of questions, and the additional questions that may not get answered will eventually get answered through Dr. McCamey and her group. So next question is a twofold double question. And this is open up to anybody, any one of the panelists that we have here. What is your entry point into academia, and why did you choose the path of academia?
I can start. So for me, I was seeing on average 24 patients a day, 24 pediatric patients. And it dawned on me that, there's such a need for pediatric providers. And by going into academia, I was able to then produce, like 20 more people a year that they could then go out and see 24 kids a day or however many they were seeing. And it really, it made a big impact when I could see that I was making a difference in access to care and other things. And when I first started, it was difficult. I was like I was just like a one-man show. And the students, my first couple of years, like they had me for everything. And so luckily I've been able to diversify the faculty, and I have more people that help and are in the program with me. And so they don't just get my perspective, they get varied perspectives. But that was my entry point and why I decided to go into it and stay here.
I can say my entry point of academia was, and I'll say the spark. I'll use that term instead of the entry point. Is when I told you when I had a student, when I did that clinical faculty position, when I was training a student, and the student was very, very nervous. She would, when I gave her a gentle critique, she would freak out and start crying, and she was doing a lot of things that was worrisome. And she was in her final semester of a nurse practitioner school. So I said, this is what we're producing. This is somebody that's going to be treating people and representing the nurse practitioner force. So I said, I have to get into academia. I can't, I'm not going to just complain and go on websites and complain about the quality of nurse practitioner education. I'm going to actually get involved and do something about it. So that was my spark. I actually had a 5-year plan, but change was the opportunity I had now came faster than expected. I was actually supposed to start 5 years later, but opportunity came and I just jumped on it. So that's my story about my spark or my entry point.
I gave you guys my story about how I got into academia, but the reasons why I stayed largely have to do with what Dr. Reyes mentioned in terms of diversity. I do believe that representation matters, and being Black in academia has its challenges, but there are a lot of reasons why I stay. And that really is because of that representation. When I'm thinking about my college experience, I didn't have a lot of faculty that looked like me. Actually, I only had 2 faculty members who, ironically, one of them now is one of my close friends, but I didn't have a lot of faculty members that looked like me. And so seeing those 2 Black women who were doctorally prepared, that showed me that that was something that I could do. So for me, being in academia is more about those that are coming after me. It really is bigger than me. I need to be what I feel like I didn't have. So that's really one of the reasons why I stay in academia. It's really to diversify faculty, diversify leadership. And if we want to increase diversity in nursing overall, I think that's a great place to start.
The next question I want to challenge you guys with is this here, and most of you've said it, but I really want you to be more specific with it. What is the most rewarding about your academia profession, and what was some of the greatest challenges you had to walk into this profession? So if you can kind of give me the pros and cons, and just kind of be a little bit more specific for our audience, because a lot of people might be at that transitioning state.
For me, the greatest reward is actually seeing students grow intellectually, professionally. They come in thinking they know what they don't. Think they know everything, a lot of them, but they don't. They soon realize that they really don't know a lot. And we, as faculty, tell them we also don't know a lot of things. So we may learn together, but as we move forward, seeing them grow is just amazing. By the time they graduate, it's so rewarding. The times that I love the best are the first day, like the orientation day, and then graduation with that cohort, because you've gone full circle with them. And so challenges, I think, in academia, Dr. Gilles mentioned being a person of color. It's often difficult because you may be one of one in a faculty, or very few of you may be people of color. So that in of itself is very difficult. For me, the longest time I had was, what's the term called? Getting a PhD or your DNP and then going straight into academia, and you're like, now I'm in charge. Now I have to make the decisions, or I have to know everything. It's kind of daunting. And I think getting over the fact that you have earned your place is a challenging thing, but you have to overcome it mentally, because a lot of us have come from places where we're always told this is not your place. But you know what? It is our place. Now that we are at a level where others are, this is our place to be. So for me, that was my greatest challenge, but I've come to a point where I know that I'm in the right spot.
I think you captured that really well. And one of the things that I really enjoy is in that first semester, when the light bulb goes off with the students, and you're like, oh my gosh, I finally broke through. You get it. You get what it means to be an NP. And then the hardest thing that I've dealt with, similar, is it's heartbreaking still in this day and age. When I went to nursing school 20 years ago, and there was no one that looked like me in my classroom or faculty-wise. And then when I have students now come to me and say, I know you don't teach my class, but can I talk to you? And they literally tell you it's because you look like me. And it's like, oh my gosh, I went to nursing school 24 years ago, and I feel like we've moved the needle, but we haven't obviously moved it enough when they come seeking you out for that. And you're just, you can relate to what they say in some cases. And then being, like right now I'm, I think in the graduate program, the only Latina. And when you go to like faculty events and they're like, oh, well, you get to go to the diversity table. And I'm like, oh, is it? I don't want to be the token person. But I think those are some of the difficulties that I've dealt with.
I can say the most rewarding thing about academia is the impact you make on the students, and especially the surprise impact. But some students will try to get in good and they say great things about you, just trying to get some your grace, and when they want to get a grade. But it's these surprise emails. I can tell you I got a lot of surprise emails and responses, particularly from students that failed my course. They said, I failed your course, but I appreciate your effort. I appreciate you actually showed professionalism. You were hard, but you were fair. So that's the reward. I'm actually, despite, was one of the things I always worry about is, are the students going to like me, or I'm going to be the most hated person? And I realized in academia over a year that no matter what, you're not going to be liked by every student. So those that don't do well, because normally it's natural. Students that do well in the class will like you. Students that fail your course will hate you. But that's why I get those few surprise emails of students that failed and said, I can see you've done everything you can. I can see that you're very fair, that you really know the stuff and you really want us to learn. So I thank you, even though I failed your course, but I learned a lot from you. So that's the reward. The challenges, and especially for me as a first year, my first year was, since I came from the clinical side, I'm the type of person that likes to learn things quickly and I adjust quickly. Academia, everything moves at a slow pace. So there's so much to learn, there's so many layers. One of the things is you must be organized. I'm generally organized, but I realized when I came to academia, I'm very disorganized. So you have to be very organized. Now I live and die by my calendar. Before I just used to remember dates, but now I realize if I don't put it on my calendar, I'm all messed up. I'll completely forget about an appointment I had or something I was supposed to do. So now I got into the process of writing all my tasks down. So that's the most difficult, trying to balance all this stuff, because everything comes at you. Keep in mind that full-time academia is not just teaching the course. So that's the one thing I had to realize. So I just can teach a course. Why the lecture teacher? I'm done. No, you have to deal with students. You have to deal with committee stuff. You have to deal with faculty stuff. You have to deal with policies. You have random meetings at the last minute that just pop up on your calendar. So I'm always scared. I can these other panelists can relate. When you have an empty calendar, an empty day, that's a glorious day. That's a very rare moment when you have nothing on your calendar, on your academic calendar. So that's a very rare moment. But all of a sudden you get an email saying, man, I guess now, you got a meeting today at 1 o'clock. So that's one of the things that can be challenging. You have to really be very organized. Don't procrastinate, because you will pay.
I agree with my colleagues. I think the biggest reward, it's really those thank you emails. It's really the students. And like I said earlier, being here is bigger than me. It's about those that are coming behind me. And you never really know who's watching you. I've had so many people just reach out to me randomly, oh, because of you, or I saw that you did this on LinkedIn, and because of you, it sparked my interest in this, and I want to pursue this. So you never really know who's watching, who you're motivating. And when you meet that stranger who's so happy to meet with you and talk to you, that's when you do really reap the reward of all the blood, sweat, and tears that it really takes to be in academia. I agree with my colleagues' challenges. I was brought up that you had to work twice as hard to get the same opportunities as people who didn't look like you. So when I started out full-time in academia, I worked really hard. I took on a lot. I wanted to be a part of every committee, any task force that was happening. I wanted to be on it. And I got burned out really fast. Work-life balance was really hard for me. And I was doing it because I felt like I needed to prove that I deserved to be there. And it's that imposter syndrome. Of course, you're there because you deserve to be there, but sometimes you don't often feel that way. So I worked really hard because I needed, for my own self, to prove that I deserve to be here. And then I quickly realized that, it's not about proving yourself to others. It's really about proving yourself to yourself, and that you don't have to work so hard to feel like you deserve to be here. You do deserve to be here. So that imposter syndrome, it kicks in every now and then. And when it does, you just have to recognize it and check it. But I would say that has been one of the biggest challenges for me.
I'm going to open up again for some questions for our audience members that's out there. I'm going to turn it back over now to Ms. Saint-Cyr. If you can give us a question or two and direct this towards all of my panelists. So I'm going to get a couple of you guys to chime in for us.
All right, so we have a question from Christine Jean Lewis. What tools have you used to help you to remain organized during your time on faculty as well in your clinical practice? Any suggestions on apps, technology, etc.?
Yeah, I will take a stab at this one. So my calendar, my Outlook calendar, I like Dr. Alleyne mentioned, I live and die by that. Now, the funny thing with the calendar is I have used an app, well, a tool online. It's called Calendly. And it allows for people to make appointments with me without this going back and forth. It just literally, you know, they click on a link and it tells them, here's when I'm available. And because I live and die by my calendar, I just show up to wherever it tells me to show up to. And that has been a lifesaver and such a time saver because, like I said, I don't have to go back and forth with people.
I agree. Being organized is a lifesaver. I live and die by my calendar as well. My work email is a Gmail, so I use my Google Calendar and I put everything on it, things that are work related, things that are not work related that I really need to do just to keep me on track. I'm a big fan of To-Do List. So one of the apps that I use is Planner Pro. I have it for my iPad, which I don't go anywhere without, and also for my cell phone. And it allows me each day to have a list of things that I need to get done. I try my best not to have more than 3 things on that list per day, but it also allows you to categorize so you can prioritize this I must do. This is next on the list and so on and so forth. So that is really what keeps me on track. I am an electronic kind of person. I'm not a paper and pen type of person. So that's why I go everywhere with my iPad. So Planner Pro is a great way to keep track of things you need to do. It does sync with your calendar. So if you look at today's date, I can see all of my meetings that I have scheduled, plus all of the things that I have on my to-do list. Because I don't leave home without my iPad, one of the apps that I use for my iPad is Notability. So that allows me to write notes. I have an Apple Pen. I keep all of my notes there. In terms of scholarship and working on projects, another great app is Trello. It allows you to keep things in order, create checklists and due dates, and you can collaborate with other people that you might be working with. So I would say those are the 3 things that I really rely on.
So I'll have Ms. Saint-Cyr go through another question, please.
All right. So this question is in regards to credentialing. So are School of Nursings now requiring a nurse educator certificate in order to serve as a faculty member and or adjunct faculty member at your institution? And do you have any suggestions on the types of certificate programs a nurse should pursue if they're interested in faculty?
So at our school, they highly they very much push for the CNE, the Certified Nurse Educator credential. And luckily we get support for that at our school to pursue that. One of the things that I did was I created a study group with for a colleague of mine, and we just developed, you know, a study plan. We looked at review books. We attended a review session and worked towards getting that. And one of the things that really helped was having a date in the future, knowing that like this test was coming up and it was hard, but it was definitely worth doing. The other thing too is that in my DNP, because I got the nurse faculty loan, they did have 2 education classes that I had to take. So that was helpful to just at least get some, you know, background into curriculum development, testing, and that kind of stuff. So it was really helpful to like have gone through that. I often wonder whether or not a postmaster's in nurse education would have been helpful, but at this point, I'm kind of tapped out with all the things that I'm doing.
That's a great question. And I feel like we get that one a lot because there are so many different pathways into education. A few of us are nurse practitioners, so we have a clinical master's degree as opposed to an educational master's degree. So that in itself has its challenges when you're a clinician going into academia without necessarily having the formal education as a nurse educator. So a lot of it was on the job training, a lot of it was mentoring, a lot of it was professional development in terms of being a clinician and preparing to be a nurse educator. I would say that certification wasn't something that was required, but for me, and I'm sure for our panelists, it was something that was a personal goal. So now there are actually two examinations. There's the CNE, the Clinical Nurse Educator, and then there's the CNE-CL, the CNE, the Certified Nurse Educator, and then the CNE-CL, the Clinical Certified Nurse Educator. There are now two exams. And so for me, as a clinician, I decided to take the CNE-CL, which is a newer exam. I think it's now been around for 2 years or so. And there are so many resources. The NLN has great resources. I have colleagues who took the exam, and so they were able to share some of their resources. I had the review book. My institution does have a Master's of Education program, and those students at the end of their program are able to take a CNE course that is given by their program director. So that was something that I was able to participate in. I read the review book, I did practice questions, a colleague gave me some flashcards and I studied that. And I would say the biggest motivation, other than it being a personal goal, but to actually do it, you really just had to set a date, and that just forces you to study. And then you go in there and you rock it and you get certified.
Alrighty, so we're gonna just do a quick round robin on this one. What do you wish you would have known before you pursued this career in academia?
That's a great question. I think for me, what I would have loved to have known is the differences in generations of students. I've learned it over time, but that would have just been so helpful. Because some of the things that students do today, I as a student never would have dreamed of doing, but at the same time, they very much know what they want, and they're not shy about letting you know, which I think is, in some ways, definitely, they're advocating for themselves. But, some of the generational differences, just would have been nice to kind of know that. And then the other thing is, I always start off orientation by saying, I'm not here to be your friend, I'm here to be your coach. And I kind of set it up so that, again, it's clear boundaries. And I was fortunate to have a mentor that was very, very, very clear on that. And so I took that away from her because, she wasn't there to be their buddy. She was there to make sure that they, were providing safe care for children. So that's what I walked away with.
I can say I learned that time is very valuable. I can say during my first semester, I spent a lot of time promoting the fact that I was a clinical nurse, clinical assistant professor. That's the time when I hit the social media page hard, but I was talking to a lot of people. People were contacting me for interviews and all these kind of things, and I got caught up into those things and then got far behind in my work. So one of the things I learned, I had to cut back on a lot of things and then focus. So that's why I did the second semester. I said, you can't do everything, you can't be everywhere. So time is very precious. You kind of went to had a negative or a false connotation that you have all this free time as academia. Even though from a time-wise from 9 to 5, you may have a flexibility, but academia occupies your mind all times. You're constantly thinking about stuff or students or quizzes you just did, or constantly thinking about something that you've done. So you have to realize that you're, even if you're not in the office or not teaching a lecture, that your mind is occupied with academia. You have to truly free yourself and just be away from everything. When I know when they say self-care, especially when it comes to academia, was the big difference is when I'm in the clinical setting. Even if I'm having a terrible day, patients are crashing, once I'm gone, I don't have to think about it. I'm home. But here in academia, it follows you home with your emails, text messages. So you truly have to remove yourself in order to get time away. Even if you're on vacation, if you look at your email, you're not truly taking vacation, even though if you're not, just because you're not lecturing. So I learned time is very valuable. Time away is very valuable.
What I would say that I wish I learned a lot earlier is that it's okay to not be perfect. I think we are our biggest critics, and sometimes we work really hard because we want to be the best. And you really have to let go of that idea of perfection. You're never going to know everything about everything, and that's okay. You're not always going to be the best, and that's okay. And it's really about your own personal growth, and you have to prioritize yourself, just like you put your meetings on your calendar and the fact that you have to prepare an exam on your calendar. Put things for you on your calendar as well, whatever that might be. So I have my massage on my calendar for on Friday because that is a part of my self-care, and I have to prioritize that because I can't take care of anyone if I'm not taking care of myself. So really, you do have to be kind to yourself. You have to let go of perfection. You have to prioritize your self-care. You do matter, and you have to remember that this is your career. This is not your life. So work-life balance is absolutely important. I don't think any of us here are perfect at it, but it's something just like anything else that you have to work at. It's important.
For me, I think I can echo everything that my colleagues have said with prioritizing things that you do to self-care. But one thing I wish I would have learned early on or been told by someone was to learn how to graciously say no. It's okay to say no. If someone wants you to participate in something, it may not be your time to participate in that thing because you may have 100 other things that you're trying to manage, and you have to learn to say no, and say no for yourself. Not no because you don't want to do it, but because if you want to commit yourself 100%, you should be able to do that. But you should also feel free to just say, I can't do it at this time. I would have loved to participate, but at this time I have to bow out. I wish I had learned that early on, because like Dr. Giles, I did burn myself out early on, trying to prove myself. So, just word of advice, learn to say no when it's, and say it graciously.
Moving on, I have another question that I like to present to you, ladies and gentlemen. And some of you kind of answered it and touched on it a little bit, but we have a lot of nurse practitioners that's out there, and some of them are leaving a full-time clinician spot. How hard or difficult was that transition into academia? So I'll open this up to my panelists.
Okay. Well, yeah, I can say very, very difficult, because I've been, like I said, I've been in a clinical setting for 12 years. And it's hard to translate, because you can know a lot. I can say I do well in the clinical setting. I've been comfortable to the point where the physicians trust me. They don't even ask me questions. They're very comfortable with me managing patients. I ran a unit by myself. They just leave early because when I'm there, they're comfortable. So I'm confident in my skill set and to take care of patients and look at diagnose and treat and look at everything and know how to exactly how to treat, but it's difficult to translate it. That's the hard part. I didn't realize how difficult it was until I started to do it. And you have to be careful, because you can tend to talk over students' heads. You also can tend to have this superiority complex, and what you say goes, and everything, and anybody that goes against you, something's wrong with them. How dare they challenge you? So you have to have an open mind and realize that you can make mistakes, and you have to find ways to translate. For me to remedy this, I made sure I met a lot with the students. So I talked to them a lot. I actually reviewed my slides, and they would, give me critiques or ask me, or they'll tell me about this question didn't make sense because of this. And after a while, I started looking at my lectures, started looking at my questions. I said, hey, that makes sense. Maybe I can simplify it. I'm doing it from my standpoint, from my understanding versus their understanding. So I've learned to simplify things, break it down to their level, and and it has helped me a lot. So I always tell the students, you actually teach me more than I teach you, because I always say, let me talk to you because I really want to learn how to be a better professor. I had one student that challenged me with lots of questions. Every time I put a lecture or exam, she always find a question to ask, no matter what. So I told her, and she thought she was kind of apprehensive of asking questions. I said, no, you're actually teaching me. You're actually making me a better professor. So this time I was ready for her, was I taught another class with her, and I would review my exams, and I'll say, what would this student ask? And I'll change the question so she won't ask, find anything wrong. And sure enough, it works. She never asked any questions. I adjusted the question to her understanding, and it made it simple. So that's a good way.
I would say that not having the formal education as a nurse educator was challenging. So, for example, I am a nurse practitioner, and in my program, I didn't learn about creating a course syllabus or a lesson plan or how to do a test analysis. So, luckily, I had a lot of great colleagues who were able to mentor me. And of course, I sought out my own professional development. I will say that being a clinician does have its perks. So in terms of my teaching style, I use a lot of storytelling and case studies. So I'm able to bring my clinical practice into the classroom, and students can relate to that. I will say for most people, you'll find that salary is a challenge, especially if you are a nurse practitioner and you've been an NP for a long period of time. I would say in most instances, if that applies to you, if you're going into academia full time, you probably will have to take a pay cut. It's unfortunate, and I think that has a lot to do with why we have a nursing faculty shortage. It's unfortunate, but it is important for us, especially nurses of color, to be in academia because that representation does matter. Luckily, in being a clinician, we can work full time in our faculty role, but at least at my institution, you have one day for your clinical practice. So I'm still able to work as a nurse practitioner in addition to being a full-time faculty member. And some people can do that to supplement their income. And you can do other things. There are so many nursepreneurs that I know of, and I'm sure a lot of us on are also nursepreneurs. There are so many things that you can do. I call them side hustles, but there are so many different things that you can do to make money. I guarantee you, if you ask any nurse, you will not meet a nurse that only has one job. We all have multiple jobs. So there are so many things that you can do to sort of supplement or balance out the income that you might lose when you transition from clinical practice into academia.
I know I had two other clinicians that's out there. Would you guys care to chime in?
I think the biggest challenge for me, similar to what has already been shared, salary was definitely a challenge. And just like I think has been mentioned, being an expert, or at least feeling like I was at the expert level for my, the clinician role that I was in. And then, understanding that I was right back at the novice level when it came to teaching again, was definitely a challenge, just, in terms of having to wrap my head around it. But it's been very, very rewarding so far.
Yeah, I think I have to agree with everyone else. But the thing that helped me transition the easiest to academia was actually having students in my practice. Even though I was not officially a faculty member, the universities had sought me out to precept. So I don't know if it's subconsciously just thought, I am a faculty member, I'm unpaid. So just thinking that way helped me transition into the actual classroom role. So if you have the opportunity to precept students in your clinical practice, that might help you transition into the classroom setting. I was fortunate enough to go into a graduate program teaching nurse practitioners. I think Dr. Reyes and Dr. Alleyne did as well. Dr. Gilles, I think, did you? I can't remember if you did graduate first, but a lot of times, especially at my university, we do have nurse practitioners who teach in the undergraduate. I can't imagine teaching undergraduate students because I haven't started an IV in years. So I think you have to choose, where you're willing to move into academia, whether it's at the graduate level teaching advanced practice nurses or undergraduates. And you still have a place at the table at the undergraduate level. It's just you're gonna have to change your mindset quite a bit. Had a long conversation with a colleague who teaches in the undergraduate. She's a PNP. She's always having to remember that when she's with students in the clinical setting, that she's not the provider. And so she has to remember to remember the basic nursing concepts rather than, the advanced practice concepts when she's teaching them. So, there are challenges transitioning, but I think taking on students early on in clinical practice may help with ease that transition for anybody wanting to seek academic position.
A question that has arose and is something that we also talked about, but want to elaborate a little bit more because sometimes there's confusion when you use the word doctor, and then it gets more confusing in nursing when you use the word PhD and DNP. So what are some of those implications in academia for PhD versus DNP?
I guess I can start. Philosophically, I think there should be there's no difference between the two. However, again, I think institutions have created hierarchies where they consider the PhD superior, unfortunately, to the DNP. And there's still a lot of people who think that way. But I think that if we work together to show that we, like I mentioned before, should work symbiotically with each other, that'll help quite a bit. My alma mater, where I got my PhD, did this fairly well because they incorporated DNPs with PhDs in the same coursework. And then, eventually we branched out into our specific roles as a DNP versus a PhD. But it just showed that we all brought something to the table, and we all at the end deserve to be called doctor like anybody else who has a doctoral degree.
I can say in my school, the notice the differences I know with the DNP projects, we do not let the students create a scientific project. They really let to the PhD. So that's the difference. And then the difference between the settings as far as a PhD versus DNP is PhD have to do a lot of research heavy activity as part of their job duties. So they have to get grants and all that stuff. And when we have faculty meetings, they talk all about this grant stuff that I don't have a clue about, because that's a lot of what the PhD does. So it's more research heavy as far as this teaching. I think we're on the same plane, but I do respect the PhD as far as the research. Was actually, before I decided to move on, I actually researched the PhD versus the DNP. And like I said, I wasn't a big fan of research. I said I couldn't handle all this research that we had to do. So that's why I settled for the more clinical route with the DNP. But like I mentioned again, I'll say this again, I'm learning the value of research. So I see myself kind of delve more into it as I progress through my academic career.
I notice a lot of people have a lot of questions for you. There's a lot of interest in the chat boxes, as you guys see. This is a question that I'm going to throw out that's a little bit off topic and not trying to give you guys any burdens or anything like that. But are you guys open up for any mentorship, any coaching or anything like that? If there's somebody that's out there that would love to reach out to you just to figure out what's in your head and talk to you, how will they go about getting in contact with you? Or can you just drop that information in that chat room for them?
I'm happy to see so many people looking for mentors and coaches. I would say that's one of the most important things that you could ever do for yourself in your career. I can honestly say that I would not have gotten a lot of the opportunities that I have gotten or been in places that I've been in if it wasn't for mentors. So mentorship is certainly very important, especially as a healthcare professional, a professor of color. You need that mentorship. And that mentor doesn't always have to be someone that looks like you, but mentorship is absolutely very important. So you do want to seek out mentors, or sometimes you'll find that people will seek you out and they see something in you that really sparks their interest. So that mentoring piece is extremely important. And at any level in your career, you can serve as a mentor. You can seek out a mentor. And I would say it is important to pay it forward. So a lot of you are looking for mentors. I think that's great. You also have to pay it forward and be that for someone else. So I can put my LinkedIn information in the chat. I'll also share my email.
I'm always open for mentorship, whether the individual is, if we hit it off well, as because you need to find someone who you're going to actually be able to communicate with. But even if we don't, there might be someone that I can refer you to and say, hey, there's this other person that I think would be a great mentor for you just because of the area of expertise or your area of interests. And again, I've learned to say no. So, it may not be that time for us to be work together. Not to say that I'm not here at a later date, but I'm always willing to be a mentor to anybody.
I actually have, like when I started out as a clinical assistant professor, I had a lot of people reaching out to me. So, and I don't mind talking to people and reaching out. I am very busy, but I do my best. So if anyone wants to reach out to me, I did put my information on the profile because I do enjoy talking to people. Sometimes I even do face-to-face through the Zoom account. So sometimes if you want to talk one-on-one, we can set up a Zoom meeting sometime and I can talk and answer any questions. So I'm always open to do that. Just reach out to me on my Instagram or my LinkedIn. So.
And I'd like to echo what everyone has said. And I'm always happy to talk to people. And I believe in paying it forward. And I very much appreciate all the help that I've gotten along the way. So, and I've dropped my information in the chat box.
And I know Miss Saint-Cyr has some questions that she's just dying to let everybody know.
Yeah, so I guess this will be the last set of questions we ask for the evening. And it looks like our next question is, how do you deal with the microaggressions and microassaults, insults, as well as discrimination within academia?
Ooh, I can tell you I dealt with that the first time. And that was part of my biggest challenge with my first year in academia. I can tell you my second semester was the most difficult. I had a class that I taught that the students were, and you normally, I always receive feedback. So I'm used to feedback because I was, as an adjunct professor, I would get normal feedback like I'm vague. The students would get mad at me because I'm vague, because I won't give them exactly what's on the exam, or they say I'm mean or I'm strict because I won't give them extra time on their quiz. But this one is a little bit different. I was actually targeted by students. And what I mean by targeted is they would send emails and they would post on a discussion board certain things. If I made a mistake, they would post it and then use it to make me look bad. And then we'll constantly do that back and forth. And then with the evaluations, there's a part for the class, critique the class, and there's a part to critique the professor. They use both sides. It looked like it was a coordinated effort to talk personally about me, certain things that had nothing to do with the class, like I don't belong in academia. How dare I am in academia? How dare I say I'm academic? I need counseling and stuff like that. It's a very distressing moment in my academic career. I was actually feel very, very low at that time when I heard those messages. I know people say don't let the students get to you, but sometimes when it comes to that level, and I felt so much hate, I can say definitely microaggression. But I did not let it get, after talking to a few people, I didn't let it get me down. I actually used it as a source of motivation and said, hey, I'm not gonna let them, because I'm doing exactly what they want me to do. They want me to be down and feel low and remove me from my position. So I actually say, you know what, I'm just gonna continue to do the best and not let these people stop me. I'm gonna show them that I can excel no matter what. So that's one of the challenges here. You see a lot of microaggression. I'm one of the few Black males. There are a few Black female colleagues I have, but I'm probably, well, there's only one other guy and he's a PhD, but I'm only one of the few Black male, especially in the acute care program. I rarely see any African Americans in the acute care program, especially when they advance. So that's very sad. So it's a rare view. Most of them, in FMP or then other colleges, not the major colleges. So I do stand out. So I'm sure that when I'm in their way of academic achievement, privilege takes over, and then they have to let it be known. So.
For me, the way I deal with microaggressions is I check it right away. I don't let it go beyond the little centimeter or inch that they've allowed themselves or give them themselves. And I don't know if it's just because I'm older and I don't tolerate a lot of craziness. And having been in the military, I know hierarchy and I know rank. So let me tell you, I will pull the rank really quickly and I'll remind them that they are the student and that there are professional behavior, conduct, contracts that they're supposed to abide by, and that certain things will not be tolerated, especially microaggressions against either myself because of me being a person of color, or another member, a student, or another faculty member. I check it fairly quickly. Oftentimes, I actually get a positive response because it may be one person that does it, and I reach out to them because I also believe that I'm not going to just leave them hanging out there. Sometimes these people are just afraid. They come from places of privilege and they don't understand that. So I bring them to the precipice of, this is where you are, and I'm going to push you off, but I'm going to push you off and I'm going to be at the bottom to pick you back up because we're going to build you back up. We're going to make you a better person. And the reason we're going to do that is because this is not okay. So I just learned early on to just check it.
I would say as a faculty of color, that's probably the most frustrating part about being in academia. I've certainly dealt with microaggressions, outright macroaggressions, and we could probably have a whole separate conversation on those types of experiences, from being called someone else's name because they're also a person of color. I once had a student say to me, I've never had a colored teacher before. Or I've had someone say to me, you're privileged because you can't get fired. You can be outspoken because if they try to fire you, you could always say that you're being discriminated against. And so there's so many different experiences, and I think it's the most frustrating part. But like my colleague said, you have to check it. You have to check it at the door, because if you allow it, then people think that it's okay. And so you have to check it. Sometimes people don't realize what they're doing and what they're saying is a microaggression. So you do have to educate them. But I would also say use your seat at the table to make change. So now that I'm in a leadership position, I'm part of the search committee and I can advocate for getting more faculty of color. Recently, I started a series called Diversity Matters Discussions, and we have different discussions with students and faculty about all things diversity. So it happens. Unfortunately, it's something that we all have dealt with and continue to deal with, but you have to check it when it happens and use your seat at the table to really make change.
Absolutely. I agree with everyone. And I think for me, I shared that I've been doing this now for 9 years, and my worst aggression that it's like it was yesterday, was my first week on the job, and it came from a fellow faculty member. And I, did exactly what people mentioned and, said something, and no one got it. No one understood what I was talking about. And then, I'm not kidding, 7 years later, somebody said, oh, that thing that happened to you, that was a microaggression. And I'm like, oh Lord. But it was just interesting because it's now come to the forefront and people are more aware of it. But, for some of us that have dealt with it in the past, people weren't as aware and they didn't quite understand. So I think we've come a long way, and I think it's just continuing, just like everyone said, check it at the door and make sure that people are aware.
Awesome. I appreciate everybody here today. This was a wonderful event. There's a lot of information that was given out. Luckily, this information is recorded, so I know it's going to be reposted. So you guys just look out for that. And as we begin to close, just one word, docs, one word, one concise word to sum up for anyone considering full-time in academia. Just a little brief statement from each one of you if someone was going to consider academia.
I'll say it's an opportunity for growth, and you have to truly have a passion for teaching to accept a full-time role.
I'll say courage in that, again, taking that leap from being an expert in your clinical field and then coming and maybe, again, being that novice. Just know that you can do it.
I'd say networking, really align yourself with people who are where you want to be. You'll learn so much from them, and they might be able to provide you with opportunities. So networking is really important.
And I would say a journey. It's not a race, it's a journey. And it takes a while to get there. So, don't be in a rush. Take your time and enjoy the time.
And as I said in the beginning, the largest room in the world is a room for improvement. I feel that with the knowledge you guys gave me today in my profession as being a clinician and also inspiring to want to look into academia, I feel that there's a lot of improvement coming my way from these topics that you guys discuss with us. At this time, I will turn this over to Ms. Saint-Cyr.
All right, well, thank you everyone for coming out, and I hope you all have a great evening.
And
thank you.
Thank you.
I just want to plug our next event on, I believe, the August 27th. Dr. Glimpf will be presenting on, help me out. Dr. Glimpf will be presenting on peer review process, so keep in mind, and also our conference is coming up in October 23rd, so make sure you sign up through our website. So